Your body tends to whisper long before it ever has to shout about cancer, and learning to hear those faint signals can be the difference between life and death. Many people picture cancer announcing itself with obvious symptoms, yet the reality is far more subtle and far more dangerous. The earliest clues are often so slight that they slip past daily attention, but recognizing them promptly can push survival odds above 90%, whereas waiting until disease is advanced can sink that figure below 20%. Today's video focuses on 8 unexpected early warning signs that may truly protect your life. These are not the usual symptoms repeated endlessly. They are the quiet, easily overlooked messages the body sends ahead of serious trouble. Perhaps you have minimized nagging aches, unusual skin changes, or unexplained night sweats, and blame them on stress when in fact they might be early alerts to something larger. This is not about fear, it is about equipping you with science-grounded insight that can change outcomes for you and those you love. Notably this year, major studies and programs have accelerated the promise of early detection, including large trials and pilots of multi-cancer blood tests that read tumor-derived DNA or RNA signals and advances in proteomic blood profiling, alongside updated American Cancer Society publications, emphasizing screening and early diagnosis as keys to better survival. Together, these developments strengthen the case for listening closely to your body and acting early so you can live longer and healthier. 8. Persistent bone pain. Many people shrug off aches, but persistent bone pain is a different story. A deep, drilling discomfort that progressively intensifies, often disturbing sleep or peaking at night, deserves attention, especially when it feels located within the bone rather than the surrounding muscles or joints. Pain that doesn't ease with typical over-the-counter medications, or that steadily worsens, is a classic warning pattern and should not be ignored. Such pain can be linked to cancers that start in bone, like osteosarcoma, or to cancers that have spread to the skeleton from other sites. Osteosarcoma, for example, commonly presents with bone or joint pain that may begin intermittently, and is frequently worse at night, becoming more constant over time. Bone metastases likewise often announce themselves first as bone pain that initially comes and goes, then becomes continuous, with night pain a hallmark feature. Swelling over the painful area, unexplained or minimal trauma fractures, or other unusual changes heighten concern and move the situation beyond normal wear and tear. The practical step is clear. If bone pain persists, escalates, interferes with rest, or appears with swelling or fragility fractures, arrange a medical evaluation rather than waiting for it to fade. Early assessment, often involving imaging and targeted tests, can rule out serious causes or catch problems sooner, offering both peace of mind and better outcomes. Notably this year, updated resources emphasize that nocturnal, progressive bone pain, and unexplained fractures are red flag symptoms warranting prompt review and potential specialist referral. 7. Body rash. Rashes are easy to dismiss as simple irritations from food, fabric, or skincare, but certain skin changes can signal something more serious, including leukemia. A key warning sign is petechiae, pinpoint red, purple, or brown spots that do not fade when pressed. This non-blanching pattern happens when tiny blood vessels bleed under the skin due to low platelets, and it can appear anywhere, often on the legs and arms. On darker skin, the spots may look darker than surrounding skin rather than bright red. If these specks show up alongside easy bruising or unexpected bleeding from the gums or nose, take them seriously, because leukemia disrupts normal blood cell production and platelet levels. When a rash like this lingers or spreads, especially with fatigue, frequent infections, or unusually heavy bleeding, medical evaluation is the next step. Clinicians often start with a complete blood count and a platelet count to check for thrombocytopenia, the low platelet state behind petechiae and purpura. Recognizing the non-blanching nature of petechiae, sometimes called the glass test, where spots remain visible under pressure, can help differentiate them from common rashes and prompt timely care. Early attention matters. Updated resources this year highlight petechiae and unexplained bruising as red flag symptoms that warrant prompt assessment and possible specialist referral. Catching these signals early improves the odds of a clear diagnosis and better outcomes. 6. Persistent fever. A temperature spike is often your body's way of battling an infection, but when it lingers or keeps returning without a clear explanation, it deserves closer attention. Recurring or ongoing fever that isn't tied to a known illness can be an early clue to blood cancers such as leukemia or lymphoma. These fevers tend to follow a cyclical pattern, rising and falling over days, and may fail to improve with standard treatments like antibiotics. They frequently travel with other red flags: drenching night sweats, unintended weight loss, and an unshakable sense of fatigue. In disorders of the blood and immune system, the body's defenses are disrupted, and the ongoing struggle against abnormal cells can generate persistent fever. Think of it as an internal alarm, signaling that something isn't right. The practical step is straightforward. If a fever lasts beyond 2 weeks or repeatedly returns without an obvious cause, arrange a medical evaluation. Even when cancer is not the culprit, chronic or unexplained fevers can indicate other serious conditions that warrant prompt care. Listen to what your body is telling you. Do not dismiss a lingering fever as a simple bug. Early evaluation can uncover the cause and may ultimately protect your life. 5. Fingernail marks. How often do you really study your nails? Small changes can hint at something far more serious, including subungual melanoma, a rare skin cancer that begins under the nail. One of the hallmark clues is a vertical, dark band running the length of the nail plate that doesn't behave like a bruise or grow out with trimming. Another red flag is the Hutchinson sign, pigment spreading from beneath the nail onto the surrounding skin at the cuticle or side folds. Because these findings can resemble trauma, fungus, or a simple bruise, they're easy to misread. The key difference is that melanoma-related streaks often appear without clear injury, evolve over time, widen or darken, and persist despite routine care. If you notice a new streak or a band that deepens, broadens, or extends onto adjacent skin, make an appointment with a dermatologist. Early diagnosis matters. Specialists often use dermoscopy and, when suspicious features are present, confirm with a nail matrix biopsy, the gold standard, to rule out cancer promptly. Recent updates underscore added context this year. Nail melanoma can occur on any digit, but often involves the thumb, index finger, or big toe. It is an acral subtype not driven by UV exposure and is proportionally more common among people with darker skin tones. And the ABCDEF approach, age, ancestry, band breadth and irregular borders, change, digit involved, extension to surrounding skin, family, personal history, remains a practical checklist to trigger timely evaluation. Paying attention to these small details can be life-saving. 4. Eye pain. Eye pain rarely tops the list of cancer clues, yet persistent discomfort or unusual visual changes can point toward ocular, uveal, melanoma, a rare tumor of the eye's pigment-producing cells where timing matters. Warning patterns to watch include blurred vision that doesn't improve with new lenses, recurrent flashes or floaters, and a dark spot on the iris that enlarges, shifts shape, or alters color, features that should trigger a prompt eye examination. Loss of peripheral vision, or a pupil that looks or reacts differently, can appear as well. Who faces higher risk? Ocular melanoma is more common in people with fair skin or light-colored eyes, and becomes more likely with increasing age. Emerging work continues to explore ultraviolet light's role, making consistent sun and UV protection for the eyes a sensible habit. The practical takeaway is simple. Regular, dilated eye exams can spot suspicious lesions before symptoms are obvious, and ophthalmologists use tools such as ophthalmoscopy, ocular ultrasound, and angiography to evaluate growth or activity. If you have persistent eye pain or any of the changes above, arrange an assessment with an ophthalmologist without delay. Urgent conditions like retinal detachment or glaucoma can present similarly and also require immediate care. What's new this year? Guidance and summaries published in 2024-2025 continue to emphasize early detection and specialist referral. And for advanced disease, there's now stronger real-world and long-term evidence for tibintafusp, the first therapy shown to extend survival in HLA-A*02, 01 positive metastatic uveal melanoma, alongside expanded access decisions in national health systems. While uncommon, ocular melanoma demands attention because early action changes outcomes. 3. Jaundice, Have you ever spotted a yellow cast to someone's skin or the whites of their eyes? That yellowing, known as jaundice, is not a cosmetic quirk, but a signal that something significant may be happening inside the body. Jaundice develops when bilirubin, the pigment formed as red blood cells break down, builds up in the bloodstream. Under normal circumstances, the liver processes bilirubin and sends it into the bile ducts for excretion. When that pathway is blocked, often by conditions such as pancreatic or liver cancer, the pigment accumulates, tinting the skin and eyes yellow. Jaundice rarely appears in isolation. Dark urine, pale or clay-colored stools, and pain in the upper abdomen are common companions, indicating that waste isn't moving through the system as it should and that prompt attention is warranted. It's important to remember that jaundice isn't always caused by cancer. Gallstones, hepatitis, and other illnesses can produce the same effect. Still, if yellowing shows up suddenly without an obvious explanation, you should seek medical care immediately. Ignoring this sign can delay a diagnosis that might be life-saving. Because pancreatic and liver cancers are frequently detected at advanced stages, recognizing jaundice early and acting quickly can open the door to earlier intervention and better treatment outcomes. 2. Unexplained night sweats. Occasional nighttime sweating happens to everyone, but when you're waking up drenched, changing clothes, and stripping the bed repeatedly, it can signal more than simple discomfort. Drenching, persistent night sweats may point to lymphoma, a cancer of the lymphatic system. These episodes rarely occur alone. They often travel with fever, unintended weight loss, and profound fatigue, collectively known in medicine as B symptoms. The underlying driver is your body's immune response to malignant cells, which can throw off normal temperature regulation and trigger intense sweating spells that soak through sleepwear and sheets. The distinction between benign night sweats and those that warrant concern comes down to how often and how severe they are. If the episodes are frequent, heavy, and recurring, especially when paired with fever or weight loss, it's time to take note. Do not chalk it up to stress or a warm bedroom. Schedule a medical evaluation. Even when cancer isn't the cause, persistent night sweats can signal infections or hormonal disturbances that also deserve prompt attention. Early assessment helps identify the root problem and opens the door to timely treatment. 1. Persistent heartburn. Plenty of people experience heartburn and assume it's just the price of spicy dinners or heavy meals. But when that burning sensation lingers for weeks or months, it can point to something more serious, including esophageal cancer. Over time, chronic acid reflux can injure the esophageal lining and lead to Barrett's esophagus, a change in the tissue that raises cancer risk. Occasional reflux is common, yet ongoing heartburn that fails to improve with medicines or lifestyle adjustments should never be brushed aside. Certain warning signs suggest the problem may be more than simple indigestion. If swallowing becomes difficult, if food feels as though it sticks in your throat, or if you notice unexplained weight loss, treat these as red flags. The right step is to seek medical care if persistent heartburn doesn't respond to treatment, or if any of these additional symptoms appear. Your clinician may recommend an endoscopy to look for irritation, damage, or tissue changes in the esophagus. Early evaluation matters. While frequent heartburn can often be managed, sometimes it is your body's way of signaling a more serious condition. Acting promptly rather than waiting can make a meaningful difference in outcomes. Your body has an extraordinary way of signaling when something is off. Signs like ongoing pain, unusual rashes, nail changes, or nighttime sweating might seem small, yet they can be early indicators of serious conditions, including cancer. By paying close attention and acting promptly, you can change the trajectory of your health. If any of the symptoms we covered feel familiar, don't delay. Speak with your doctor and take charge of your next steps. Early detection remains one of the strongest tools we have against cancer, and it begins with awareness. For more practical guidance, life-saving insights, and empowering information, explore our other videos. If this video was helpful, please like it, share it, and subscribe to Healthy Care. Together, we can raise awareness and help more people live healthier, happier lives. Thank you for being part of this important conversation. Your health is your most valuable asset. Protect it, make it a priority, and live your best life.